Dr. Ed Zimmerman, Aesthetic Revolution, Las Vegas. Let's talk a little bit about pre and post operative lipo instructions. You've come to the office, you've decided you do want to have liposuction, which is a body contouring procedure. It takes away some of the fat between the skin and the muscle that Mother Nature and your parents blessed you with, that just doesn't go away with dieting and working out and stuff like that. So lipo is not so much a treatment for obesity as it's a treatment for body contour. And it can be anywhere on the body. We do lipo pretty much from the jawline or even the jowls all the way down to the ankles. We do much more of the neck, the chest, male and female, by the way, the armpits, the arms, the torso, regular and high def, down along the pubic area, the tuchus if it sticks out too much because the pendulum's swinging the other way, and then a lot of thighs and occasionally even calves and cankles. So those are areas that can be done. You need to understand when you make a commitment to doing this, this is a surgery. Yes, it's done in an accredited facility. We are a nationally accredited AAAHC accredited operating room, and even though you may not be put fully to sleep, although we can put people fully to sleep if we need to, lipo is generally done under twilight or conscious sedation. So why is that good and for most people, and why do we care? Because lipo generally we're going to do after we've marked you standing up. So we see the effect of gravity on the tissue and we put you in front of a full-length mirror in some skimpy disposable paper panties and such, and mark all the different colors. We mark the elevations, we mark the relative deficits of space and shadow, we mark where we're going to hide our insertion sites, inside folds or under a fold or inside a belly button or wherever. So we want to make the insertion sites as invisible as possible. They're only 3 to 5 millimeters. They'll generally heal a little lighter or darker depending on your heredity, but we don't want to leave a mark any place that we can have it be visibly seen if we can help it. Okay. Then, how are you going to prepare for this? We're going to do several things. No smoking, no vaping, no anything that's going to clog up your lungs for a week or two at least before your procedure. Because even if we're not putting a tube down your throat, you're not breathing as deeply. Even if we're monitoring you continuously when we have IV access, and we can put oxygen on you if you need it and such like that, we still want to have you control your own breathing and not be at risk for aspiration. So get rid of the nicotine and other things for a couple weeks before surgery. If you are having anesthesia, full general anesthesia that we offer with a boarded anesthesiologist, that's important as well. He or she is going to tell you no smoking for a couple weeks before and after at minimum. So talk to us about that if that's an issue. We're also going to have you not take blood thinners. So no aspirin, Advil, ginkgo, garlic, ginger, fish oil, selenium, all those things that can cause a blockage in the clotting cascade so that you don't ooze, bruise, and swell more from your surgery than you usually would. So get those out of your system. Tylenol, acetaminophen is probably a reasonable thing, but watch all those herbals and oils. They're potent anticoagulants, as is, by the way, CBD and THC. They will make you ooze and bruise as well. We found that out the hard way when it first got legalized here in Nevada, so watch that as well. No alcohol for a week or two before the surgery. Why? We want the receptor sites available for the medications that we give you. So we're going to give you both oral and injectable medications, so sedatives and opioids. They've got to have the receptor sites free, and alcohol gets in the way of binding those receptor sites so that you get a nice nap while we're doing your procedure. Now, you'll still be able to respond very often to instructions. So say we're doing male or female chest lipo or whatever, we can help you sit up and we can go flex, stretch, and I can remark after I've filled you up with tumescent fluid and sculpted for a while. I can remark all those areas, fine tune them. After we fine tune, get you up, stretch again when everybody's happy, and my staff is very critical of the work. Then we can go on and do our tissue tightening with Renuvion if we need to, or a little skin excision if we need to, things like that. But it's very methodical, stepwise what we do, keeping you comfortable the whole time. To prepare your skin and lower the bacterial count on your skin, It's really helpful if you cleanse for 3 days or so before your surgery from head to toe. I know it's drying, but you'll get over it. With HibiCleanse or a similar antimicrobial. It's just going to lower the bacterial count on your skin. Liposuction is probably one of the safest elective outpatient procedures that we do, and we've rarely had an infection over the past 20 years, and that's generally been when there have been kids or pets in the house. So be prepared to keep those at bay, because they are walking contamination zones trying to get under your skin, literally, to cause an infection. So we're going to put you on antibiotics ahead of time. We're going to use sterile tumescent solution that we're going to numb the areas with. We're going to use a surgical scrub, but before we do all that, you can decrease the bacterial count on your body by using an antimicrobial like Physahex, HibiCleanse, or one of those, that whatever's available, but something similar. The areas that we're going to treat would benefit from being trimmed. So, you know, we want to, if we're holding absorbent pads over the tiny incision sites, insertion sites, we want to be able to tape those in place while we pull on your compression garment at the conclusion of surgery. And we don't need to give you a free wax job with our tape, even as though it's a paper tape or a surgical low allergy tape. So if you trim the hairs, you don't want to shave the hairs right before any surgery, because those micro scratches that a razor puts in the skin is just another place for bacteria to go in. But if you trim close to the skin or shave a few days ahead, each of those is fine. If we're not using general anesthesia, if we're just using twilight or conscious sedation, we'll actually ask you to have a bland meal and hydrate well ahead of time. Hydrate well makes it easier to start your IV or draw blood if we're using platelet-rich plasma for the procedure. And you know, you'll feel better, and we'll get better circulation of our medication, so it won't take as much, so it won't be as hard to get you out of anesthesia, keep your tummy happy with the medications, and get you so you can go home that night. What else? Wear loose fit clothing. So in the areas that we're not working on, wear something that's easy to get on and off. So if you want to visit the restroom where the nurse is helping you or whatever, before or after the procedure, don't wear lots of belts and zippers and snaps and things like that. Wear some comfortable gym clothes, you know, something that you can get dirty if some surgical scrub gets on it or something like that. We're going to move those out of the way in general. So, you know, you'll be able to keep your clothes on in the areas we're not working. That's fine. We're going to put sterile drapes over them and scrub all the areas we're working on adjacent to that with surgical scrub. But otherwise, if you're getting neck lipo or anything done on the torso, wear a comfortable garment that you don't have to pull over your head. Wear something that buttons easily or zips easily, doesn't have a lot of snaps and grommets and stuff like that. If we're not working on your chest, if you're a gal, you can wear a jog bra, something that easily gets out of the way and doesn't have any metal, so we don't have to worry about any of our wires or electrodes or monitoring things or grounding pads having an issue with anything that's metal in those. Okay. At home, get an old shower curtain and throw it over the reclining chair or bed or wherever you're going to be. We're going to give you some Chuck's pads. We're going to have a laundry list of things that you can pick up to have them available. So if you have some oozing after liposuction, it looks scary, but it's mainly the tumescent fluid that I've put in to make you numb so that I can sculpt the fat out between the skin and the muscle. Your body absorbs some of it I suction out, and some of it comes out over the next 3 to 5 days. All of your leakage is generally done by the time you're 3 to 5 days out. And then you just have some swelling of the tissue, like when you sprain an ankle and the tissue gets hard with fluid to hold it in place. That's Mother Nature's way of making a cast. That's why we put you in a compression garment, and you gotta stay in it. For that first few days, if you take that compression garment off, you can loosen it a little bit, but if you take it off, you may swell so fast that it's very hard to get it back on, and that's going to decrease the rate that you're able to get back into normal activity. So we want to keep the swelling under control with moderate compression for that first 3 to 5 days. Then we'll start letting you out to shower increasingly let you out after, first you're going to have it on 23/7 for a week or two, and then after your lymphatic drainage massages, the gals will eventually tell you that the tissue is draining nicely again. The lymphatics have reconnected, and you'll be able to just wear the garment during the day. But you're going to wear it for about 6 weeks, so know that. Leave your jewelry and all your fancy makeup and all that stuff at home the day of surgery. No reason to have it here. We don't want it to be responsible for it, so take off all your nice jewelry, leave that at home. Don't wear any makeup, deodorant, fragrances, any of that kind of stuff. That's all stuff